Hi, my name is Sierra. I'm doing my injection technique video today on the patient Mr. Mancini, who is a blob. So we're going to be administering both a sub-Q and an IM injection. So the first injection is our sub-Q. It's a heparin dose. We're giving 5,000 units per 1 ml. That's the supply we have is 1 ml of heparin. And then our IM injection is Haldol. So we're giving 1 milligram IM. Our supply is 4 milligrams per 2 ml vial. So we're going to be giving him 0.5 ml of Haldol. So before we give the injection, we obviously want to prepare the needle. It's important to use hand hygiene. So I'm going to start by sanitizing before I do them. When we're doing the injection, we'll also want to put gloves on, so I'll do those when I give the injection. And we're going to start by using blunt needles. So for the sub-Q injection, we're going to be using this vial. It's a 3 ml vial, and it has the 1 ml right here. And that's the supply we need. For the IM injection, because we're only giving 0.5 ml, we're going to be using a 1 ml needle with the 0.5 marking here. So I will prepare these. It's also important that the patient understands the 8 medication rights. You want to go through the MAR and perform those rights before and during your injection on the blunt. So we want to twist it in. When doing gauges, it's important that we consider the body build of the patient. There's no chart data for Mr. Mancini's body build, so we're going to go ahead and assume that he is a normal body build for his age and height. IM injections, however, that will vary on the patient's amount of fat on their body, their fat deposition, and how much muscle they have as well. For the gauges, for the IM injection, we're going to be using a 22 gauge. For the sub-Q injection, we're going to be using a 25 gauge, which I have both here. So I'm going to start with the heparin. So I'm going to be inserting 1 ml of air in here. So I'm going to insert the blunt, push it in, and then draw back. The liquid is in. We want to get rid of all the air bubbles. So flick them to the top, and then we're going to just shoot out the air, and we want to see some liquid coming out. We want to get it down to 1 ml. That's good, it is leaking sufficiently. Perfect. So now we're gonna put the cap back on. We're going to remove it. And that is when we want to put our gauge on. And now for the IM injection. So we're going to draw back. Okay, so we're going to insert, push, and draw back our fluid. Okay, and then we're gonna air bubbles, push it to 5. There we go. We're gonna re-seal the blunt cap, take it off, and then we will put the 22 gauge on, and then we're quickly going to label them. So that way I'm not confusing the syringes. So once we reach the patient, again, I'm going to be performing hand hygiene. All right, so once we get to the patient's room, we do want to introduce ourselves. Also just check their wristband. If you can scan it, make sure that you have the correct medication, again, those medication rights. We also want to tell them we're going to be giving them the injection, so the Haldol and the heparin. The heparin being the anticoagulant Mr. Mancini has, and the Haldol the antipsychotic. So we do want to make sure that their skin is well cleansed. So for subcutaneous, I'm going to be doing it as though it's in the abdomen. So this is the heparin injection. So we're going to unscrew, or take the cap off rather. So we do want to squeeze the skin a little bit, and we want to put it in at a 45-degree angle. And we're going to insert it swiftly and inject. Remove it, cap back on, and we will be disposing it in the sharps bin. So for the second injection, this is the Haldol. We're going to be inserting it right near the tip of Mr. Mancini's pelvis. There's a soft spot right there where we can inject IM injections. So again, we want to cleanse the skin. So when doing this, we want our 2 forefingers to be at the top of the pelvis, right where the pelvis arcs around the hip. So we want to put those 2 there and our thumb placed just below them. So that's the placement. We're going to take off our cap. For IM, we are doing a 90-degree angle. We're going to insert it right here, inject out, and then we put the cap back on and dispose it under sharps. And that is that.